from what I see today, no infection, inflammation. I would definitely stay on the Pulmicort,
I have been, I mean, that's like
the
a,
steroid rinse. I would definitely stay on the Astepro, the antihistamine. And I would also think about whether or not you need the shampoo. Right now, I don't think you need the shampoo because it doesn't look infected. We use the
Okay.
shampoo only when there's a lot of infection in there.
oh, okay.
And so if we don't see infection, we don't use the shampoo.
Does it hurt anything?
The shampoo can decrease your sense of smell.
Oh,
And so using the shampoo without infection kind of doesn't have a great benefit, and it may actually cause your sense of smell to go down.
I have a strong sense of
So
smell.
let's keep it. So the big factor for you is going to be using the Q-Nasal and the Pulmicort.
Should I be taking 1 or 2 sprays of Q-Nasal?
I would use the Pulmicort wash twice a day,
Twice a day?
and I'd
Okay.
use the Q-Nasal once a day.
How many sprays of Q-Nasal?
1 spray in each nostril once a day.
Okay.
That should be enough. If it's more convenient, you could probably use the Q-Nasal 2 sprays in each nostril at bedtime, along with the Astepro. But this is just playing around with the Pulmicort, Q-Nasal, and Astepro at this point. Nothing beyond that.
So the Pulmicort AM and PM.
You could do that. Yep.
Oh, I thought that's what you said.
That's what I would do.
Yeah, because
I
I think, I remember Dr. Rubenstein saying, you know what? I'd rather you maybe use Q-Nasal in the evening rather than the Pulmicort. I
Yep.
don't know, does the Pulmicort affect anything?
No, the Pulmicort, the liquid can stay in your nose, and then you lie down at night and it kind of chokes you a little bit. So if you do use Pulmicort at night, use it around dinner time so that most of
Okay.
the water is gone by the time you go to sleep.
Should I, at night, rinse again or not? Because then I'd be getting rid of the Pulmicort.
I would not.
Okay.
Any special instructions for flying?
Yes.
Oh, wipe off the seats around you
Oh, he does that.
with the baby butt wipes. Just wipe off all the seats, the front of the seat, the side of the seat. Afrin nasal spray, 20 minutes before takeoff and 20 minutes before landing.
How many sprays of the Afrin?
1 spray in each nostril, 20 minutes before takeoff and 20 minutes before landing. And then lastly, some patients benefit from using Mucinex. Just regular Mucinex, guafenicin, not the D.
Oh, I take 1D in the morning
Okay.
and then 600 milligrams
Okay.
of the regular,
Regular.
but extended with, and then in the evening, not right before I go to bed, but a little before I take 1200. Because I figure,
Perfect.
you know what, let's just,
So you're doing the right thing. Nothing else to
yeah,
do.
but it still looks like this. But I'm going to be flying again, so I figured I better, just,
Well, what I see does not look scary.
okay. So when is it if I keep on getting infections that then you think of?
I would like to see you during these infections to find out what organism it is.
Yeah, because the last time it was at Pseudomonas. When does one think of surgery? I mean, in my mind I go, oh, I wish they could just open those holes bigger and then the stuff, because my problem is it doesn't drain. He gets like globs.
Six infections per year.
Oh, I guess I'm okay. I just put up with this part of my language shit.
Yep, because we're working between your eyes and onto your brain when we do sinus surgery. Very unlikely to have any complications, but we really have to say medicines are not working, we're growing all these
Okay.
weird bugs, and you haven't reached that point yet.
Good, good. Okay, so I just put up with it, as I call the chachis.
Yep, moisture, 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 and you're doing as much as you can.
Yeah. Does it, I mean, I drink a lot of liquids.
Keep going.
Is it bad if I have like Coke Zero?
In terms of your sinuses,
Well, I mean, in terms of a liquid, is that okay? I mean, I have tea, water, and the Coke Zero, does that do anything?
not for your sinuses, no.
Okay, so it doesn't dry you up or, okay. So CT scan I would only need if you saw an infection, and she was saying that it's not bad because it's a baby dose of
It's a
this.
baby dose, but it's still radiation.
Yeah.
And I don't think you need it. If I looked in there and I saw a ton of infection, or you've been having 6 infections a year, and we're heading down the surgery pathway, then I'd get a CT scan. So let's touch bases in 3 months,
Okay.
and have you keep track of how often you get in trouble in the next 3 months.
Okay. Well, we're only